Welcome to PharmD Lectures, Pharmacy Made Easy, explained by someone who's lived every late night, every viva, and every tough concept. So let's go and make this simple. Have you ever thought about how our brains work differently and how that diversity can be a strength? Today we are exploring neurodiversity with a focus on autism spectrum disorder, or ASD. ASD is a neurodevelopmental disorder that affects how people process information, interact socially, and experience the world. It's not just a condition, it's about unique perspective that can lead to innovation in fields like pharmacy and healthcare. As pharmacy students, understanding ASD is crucial because it ties into mental health, pharmacotherapy, patient care, and creating inclusive environments. We will cover what ASD is, its challenges, strengths, and how to support those with it. This lecture will give you practical insights for your studies and future practice. So don't forget to like, comment with your thoughts, and subscribe for more. So the very first is, what is Autism Spectrum Disorder, ASD? Autism Spectrum Disorder, ASD, affects the way the brain processes information and interacts with the world. It is characterized by challenges in social interaction, communication, and repetitive behaviors or interest. Students with ASD may have unique strengths and abilities, as well as specific areas where they may need support. Understanding ASD and embracing neurodiversity is crucial in creating an inclusive and supportive community. So basically, ASD is a neurodevelopmental disorder that affects the way the brain processes information and interacts with the world. It's called a spectrum disorder because symptoms and severity vary widely from person to person. People with ASD often face challenges in social interaction, like forming relationships, communication, such as expressing thoughts clearly, and repetitive behaviors or intense interests that might seem unusual to others. On the flip side, students with ASD may have unique strengths and abilities like exceptional memory or creativity, and specific areas where they need support, such as adapting to new environments. Embracing neurodiversity means recognizing that these differences are part of human variation, not deficits. In pharmacy, this is important because medications like selective serotonin reuptake inhibitors, SSRIs, which help regulate neurotransmitters in the brain, might be used to manage co-occurring conditions like anxiety in individuals with ASD. Understanding ASD helps us build a more inclusive community where everyone's contributions are valued. Students with ASD may find it challenging to understand and navigate social situations, interpret non-verbal cues, or engage in conversation. Students with ASD may engage in repetitive movements or have specific interests or routines. We are looking at some key indicators of ASD now, right? Specifically, challenges in social interaction. Students with ASD may find it challenging to understand and navigate social situations, interpret non-verbal cues like facial expressions or body language, or engage in conversation. For example, they might not pick up on sarcasm or subtle hints in a discussion, which can make group interactions tricky. This isn't about a lack of interest, it's often due to differences in how the brain processes social information. Neurodiversity reminds us that these indicators are just one way of experiencing the world. In a pharmacy context, recognizing these signs can help when counseling patients or working in team settings, ensuring we communicate clearly and patiently. Some students with ASD may experience difficulties in verbal and nonverbal communication, such as understanding figurative language or maintaining eye contact. Okay, so let's delve deeper into communication difficulties. Some students with ASD may experience challenges in verbal communication, like struggling with spoken language, and non-verbal communication, such as maintaining eye contact or using gestures. For instance, they might have trouble understanding figurative language expressions like "it's raining cats and dogs" that aren't literal, or responding promptly in conversations. This can stem from differences in brain wiring that affect language processing centers. It's not that they don't want to communicate. It's about the brain's unique way of handling information. As pharmacy students, you might encounter this in clinical settings where clear, straightforward communication is key, perhaps when explaining medication side effects using simple terms to ensure understanding and compliance. Then we have challenges. Students with ASD may struggle with understanding social cues, making friends, or interpreting others' emotions, which can lead to feelings of isolation or exclusion. This slide highlights the broader challenges of ASD, particularly with social cues and emotions. Students with ASD may struggle with understanding social cues like tone of voice or social norms, making friends, or interpreting others' emotions, which can lead to feelings of isolation or exclusion. For example, they might not recognize when someone is upset based on facial expressions, leading to misunderstandings. This is often linked to differences in the brain's social cognition pathways. In pharmacy education, being aware of these challenges can prepare you for patient interactions, such as in mental health pharmacotherapy, where empathy and support are essential to reduce stigma and improve outcomes. Many students with ASD have heightened sensitivities to sensory stimuli such as loud noises, bright lights, or certain textures, which can be overwhelming or distracting. Some students may find it difficult to adapt to changes in routines or transitions, leading to anxiety or discomfort. This slide covers sensory sensitivities and routine changes. Many students with ASD have heightened sensitivities to sensory stimuli such as loud noises, bright lights, or certain textures, which can be overwhelming or distracting because their sensory processing systems are more sensitive. This means everyday environment like a noisy classroom or a bright lit pharmacy might feel intense. Additionally, some students may find it difficult to adapt to changes in routines or transitions, leading to anxiety or discomfort as their brains thrive on predictability, right? In pharmaceutical terms, this could relate to how certain medications like antipsychotics might be used to manage associated anxiety, but it's always about individualized care, right? Understanding this helps in creating supportive spaces, whether in education or practice. Then we have supporting students with ASD. Teachers and peers can support students by providing clear and direct communication using visual supports and encouraging inclusive social interaction. This slide discusses ways to support students with ASD. Teachers and peers can support students by providing clear and direct communication, avoiding ambiguity, and using straightforward language, using visual supports like charts or pictures to aid understanding, and encouraging inclusive social interactions such as group activities with structured guidelines. This approach leverages neurodiversity by meeting individuals where they are. For pharmacy students, this translates to skills in patient counseling, where clear instructions on medication use can make a big difference in adherence and health outcomes. Creating a sensory-friendly environment by minimizing distractions, providing quiet spaces, and considering individual sensory needs can greatly support students. It's important to tailor teaching strategies, offer visual schedules, and provide additional support. We are focusing on creating a sensory-friendly environment. This involves minimizing distractions like reducing background noise or harsh lighting, providing quiet spaces for breaks, and considering individual sensory needs such as allowing noise-canceling headphones. It's important to tailor teaching strategies, offer visual schedules to outline daily routines, and provide additional support like one-on-one guidance. Alright? In pharmacy, this could mean designing patient areas that accommodate sensory sensitivities, ensuring that neurodivergent individuals feel comfortable when receiving care or medications. Strengths of students with ASD. Many students excel in areas that require focused attention, such as art, mathematics, or problem solving. Students with ASD often have unique perspectives on the world, which can contribute to creative thinking, innovative ideas, and different ways of approaching challenges. Students with ASD may develop intense interest in specific topics and accumulate extensive knowledge in those areas, bringing unique insights to discussions and projects. For instance, someone passionate about chemistry might have in-depth expertise that enhances collaborative work. This isn't just a hobby, it's a strength that can lead to expertise in areas like pharmaceutical sciences, where specialized knowledge is invaluable. Embracing neurodiversity means recognizing and celebrating the diversity of human beings and the strengths that come with different ways of thinking and experiencing the world. This slide defines embracing neurodiversity. It means recognizing and celebrating the diversity of human brains and the strengths that come with different ways of thinking and experiencing the world. Neurodiversity is a concept that views conditions like ASD not as disorders to be fixed, but as natural variations that enrich society, much like biodiversity in nature. We should respect and show empathy towards our neurodivergent peers with ASD, understanding and appreciating their unique perspectives and abilities. By fostering an inclusive environment, we create a sense of belonging where all students can thrive and contribute their individual strengths. We emphasize respect and empathy. We should respect and show empathy towards our neurodivergent peers with ASD, understanding and appreciating their unique perspectives and abilities. By fostering an inclusive environment, we create a sense of belonging where all students can thrive and contribute their individual strengths. In pharmacy, this fosters better patient-provider relationships and equitable healthcare. Tips for supporting students with ASD: practice patience and understanding, use clear and concrete language, encourage inclusive social interactions, provide visual supports and predictability, respect sensory sensitivities and individual needs, foster a positive and accepting classroom culture. Finally, this slide provides practical tips. Practice patience and understanding by giving time for responses. Use clear and concrete language to avoid confusion. Encourage inclusive social interactions through structured activities. Provide visual supports and predictability like schedules. Respect sensory sensitivities by adjusting environments and foster a positive, accepting classroom culture to promote well-being. These tips are directly applicable in pharmacy practice, from dispensing medications to supporting mental health. Right? That wraps up our lecture on neurodiversity and ASD. I hope this has given you a deeper appreciation for these topics and their relevance in pharmacy. Remember, as a future pharmacist, your role in supporting neurodivergent individuals can make a real difference. If you have questions or experiences to share, leave them in the comments. If you found this helpful, give the video a like, share it with your peers, and subscribe to the channel. Right? Signing off until the next lecture. Till then, take care of your health, revise your notes, and keep memorizing. So best of luck for your exam. So this was PharmD Lectures, Pharmacy Made Easy, because I have been through where you are right now and I know how hard it gets. So if this helped you, pass it on, take care, keep learning, and Allah Hafiz.